Two key developments from the United Nations perspective this week: access and resources. First, an agreement reached with Syria's government to open additional border crossings from Turkey into northwestern Syria, a region hard hit not just by the earthquake, but also almost 12 years of civil war, and where aid was initially slow to trickle in. Additionally, flash appeals for funding were also issued: $1 billion for Turkey and almost $400 million for Syria. The UN says those funds would ensure assistance to people with the most urgent humanitarian needs, covering an initial period of 3 months.
I have an urgent message to the international community. The human suffering from this epic natural disaster should not be made even worse by man-made obstacles. Access, funding, supplies. Aid must get through from all sides to all sides through all routes without any restrictions. I urge member states and others to fully fund this effort without delay and help the millions of children, women and men whose lives have been upended by this generational disaster. This is a moment for unity, for common humanity and concerted action.
Views echoed across the UN system, including from the Director General of the World Health Organization, who visited Syria days after the quake.
I saw the destruction of entire communities, the unspeakable suffering of people, and the courage and determination of survivors and responders. WHO is providing care to survivors with injuries and disabilities sustained in the earthquake, hypothermia, mental health and psychosocial needs, the increased risk of infectious disease, and the range of regular health needs.
Earlier this week, senior UN officials, including the Emergency Relief Coordinator, acknowledged that people in Syria rightly felt abandoned, looking for international help that was slow to arrive, but that aid was now flowing through several border crossings and across front lines.
I'm here at the Bab al-Hawa crossing point between Turkey over there behind us and northwest Syria. And what we're seeing here is a convoy of humanitarian aid. We have a daily convoy going through. We have about 10 trucks in this one going through to provide for the urgent humanitarian needs of people in northwest Syria, over 4 million of them who need our assistance, and for whom the earthquake has been an extraordinary, devastating experience. These trucks are a lifeline. We've been resuming operations here for the last 4 or 5 days. We're ramping up the scale of it so that we can begin to meet the needs of those people.
While, as with any disaster, women and children find themselves in an even more vulnerable scenario.
We estimate that there are around 130 to 140,000 women who are of reproductive age and require medications, services, and protection from gender-based violence. From them, an estimated 40,000 across all of the territories in Syria are currently pregnant and will deliver within the next 3 months. Many of the facilities that we visited are already depleted or damaged or both. There are stockouts of medications for treating even very basic things like the flu, much less something as complicated as having a C-section.
More than 20 million people have been directly impacted by the quake in both countries. As Mother Nature added an additional layer of destruction and despair to a region all too familiar with suffering and hardship, the UN Refugee Agency says in Syria alone, some 5.3 million people had been left homeless, or put another way, a number comparative to the entire population of Johannesburg. As the world body appeals for international solidarity for a region where needs are vast, where the scale of disaster is epic, and the road to recovery long and arduous on a canvas of grief. Sherwin, Bryce-Pease, SABC News, New York.